Hi Jim, my name is Mark. I'm here to go over some liver lab tests with you. Do you know about liver lab tests? No? Okay, well, I'll go over them. The first test is albumin. The normal range is in adults is 3.5 to 5.2 grams per deciliter. Albumin tests nutritional level and liver or kidney disease. Things that can affect the lab results though are prolonged bed rest and fluid overload. The signs of increased levels can be dry mouth, dry skin, and thirst. Decreased levels can be difficult with healing wounds and feeling very tired. Health problems detected by this test are burns and starvation. Pre-test is what we're going over now, is to help you understand the purpose of the test, how it's performed, and what you must do to be ready. So let me know if you have any questions. I will provide clear written instructions at the end of everything we're going over. Once you arrive, they'll take a blood sample. After the test, they will go over the findings with you and check for swelling of legs. The next test is alkaline phosphate, ALP. Adults, normal is 52 to 142 units per liter. This test is mainly used to determine liver and bone disease. Things that can affect the lab though are fatty meals and if you're on blood thinners. Are you on blood thinners? No. Okay, good. Increased levels can show jaundice, bone pain, itchy skin. Decreased levels can show weakness. Health problems detected are cancer spreading bone tumors and Hodgkin's disease. Well, we need you to fast before this test. Once you arrive, they'll take a blood sample. And after the test, they'll go over the findings and look for liver or bone disease or tumors. The next test is alanine aminotransferase, ALT. Normal range in men is 10 to 40 units per liter. The purpose of this test is to determine liver disease. The lab results are affected by too much body fat or if you're on blood thinners such as heparin. Increased levels can show loss of appetite, jaundice, or dark colored urine. Decreased levels can show generalized weakness and deficiencies of B6. Possible health problems detected could be cancer spreading liver tumors and severe burns. And once you arrive at the testing site, the nurse will obtain a blood sample and mark your name and information on it. After the test, they will go over the findings. The next test is aspartate aminotransferase, AST. Normal in men is 14 to 20 units per liter. This test shows how much of the liver or heart is damaged. Drugs that can affect the lab test are acetaminophen, Tylenol, or drinking alcohol, or if you're diabetic, and ketoacidosis. Increased levels can be shown by fatigue, right upper abdominal pain, nausea, or jaundice. Decreased levels can make you feel very sick, muscle weakness from B6 deficiencies. Health problems detected can be acute alcoholic hepatitis or gangrene. Again, I'll provide information about the location and the site. Once you arrive, they'll take a blood sample and they will go over the findings with you. The next test is direct bilirubin. Normal is 0 to 0.3 milligrams per deciliter. This test evaluates liver function and red blood cell count. You need to avoid high-fat meals. Increased levels can cause jaundice, pale colored stool. Decreased levels can make you feel weak. You need to fast before this test also. Once there, they will take a blood sample and then go over the findings with you. Total bilirubin is 0.3 to 1 milligrams per deciliter. This test will evaluate liver function. Things that can affect this are yellow foods. Increased levels can cause jaundice and weakness. Decreased levels can make you interfere with cellular function. Possible health problems detected are cirrhosis and viral hepatitis. If you have any fears or questions, let me know. The next part of the test, they will take a blood sample and afterwards they will review the findings. The next test is total protein. Normal is 6.0 to 8.3 grams per deciliter. This test is used to detect liver problems, inflammation problems from immune problems. The things that can affect lab results are prolonged bed rest and taking in too much fluids at once. The increased levels can show dehydration and weakness. Decreased levels can show muscle weakness and fragile of hair. Health problems detected are continuing liver disease and connective tissue diseases. You will need to take a 24-hour urine test and provide that to the testing site. Do you have any? They will go over if you need any follow-ups. Here's the paper for your information. Have any questions? Have a good day.